ನಮಸ್ಕಾರ ಎಲ್ರಿಗೂ. ಮಂತ್ರಗಳ ನಮಸ್ಕಾರ. ನವರಾತ್ರಿಯ ಶುಭಾಶಯಗಳು. ಹಿರಿಯರ ಚಾವಡಿ ಆರೋಗ್ಯವಾಣಿ ಸೀರೀಸ್ ಇದು ಸಾಧಾರಣ ಈ ವರ್ಷ ಮೊದಲಿಂದ ಪ್ರತಿ ತಿಂಗಳು 2ನೇ ಮಂಗಳವಾರ ಸಾಧಾರಣ ಈ ಟೈಮ್ಗೆ ನಾವು ಸ್ಕೆಡ್ಯೂಲ್ ಮಾಡಿದ್ದೇವೆ. ಚೆನ್ನಾಗಿ ಬರ್ತಾ ಇದೆ. ಸೊ ಇದರದ್ದು ಯುನೀಕ್ ಫೀಚರ್ ಏನಂತ ಹೇಳಿದ್ರೆ, ಇದರಲ್ಲಿ ನಮ್ಮ ಭಾಗವಹಿಸುವ ಗೆಸ್ಟ್ ಸ್ಪೀಕರ್ಸ್ ಅವರು ನಮ್ಮ ಕುಟುಂಬದ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊಫೆಷನಲ್ಸ್. ಪ್ರತಿ ತಿಂಗಳ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಸ್ಕೆಡ್ಯೂಲ್ ಮಾಡುವಾಗ ನಾವು ಫೀಚರ್ ಮಾಡೋದು ನಮ್ಮ ಕುಟುಂಬದ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ಆಗ್ತಾರೆ. ಸೊ ವಿ ಹ್ಯಾವ್ ರಿಯಲಿ ಬೆನಿಫಿಟೆಡ್ ಫ್ರಮ್ ಹ್ಯಾವಿಂಗ್ ದಟ್ ಕ್ಲೋಸ್ನೆಸ್, ಏನೊಂದು ಫ್ಯಾಮಿಲಿ ಅಡ್ವೈಸರ್ ತರ. ಸೊ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಾವು ಹೋದ ತಿಂಗಳು ಶ್ರೀಕಾಂತ್ ಬೆಲ್ಪು ಅನ್ನೋ ಅವರು ಹೆಲ್ತ್ ಇನ್ಶೂರೆನ್ಸ್ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ರು. ಇವತ್ತು ಅದನ್ನು ಮುಂದುವರಿಸುವ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದ ಫೋಕಸ್ ಮೆಡಿಕೇರ್ 101 ಅಂತ. ಸೊ ಮೆಡಿಕೇರ್ ಹೆಲ್ತ್ ಕೇರ್ ದೊಡ್ಡ ಆಳವಾದ ಒಂದು ಸಬ್ಜೆಕ್ಟ್. ಸೊ ನಾವೊಂದು ಬೇಸಿಕ್ಸ್ ಇಂದ ಶುರು ಮಾಡುವ, ಫಂಡಮೆಂಟಲ್ಸ್ ಇಂದ ಶುರು ಮಾಡುವ, ಮತ್ತೆ ನಮ್ಮ ಕುಟುಂಬದ ಸದಸ್ಯರಿಗೆ ಹೇಗೆ ಇಂಟ್ರೆಸ್ಟ್ ಉಂಟಾ, ದೆನ್ ವಿಲ್ ಕಂಟಿನ್ಯೂ ಟು ಬಿಲ್ಡ್ ಆನ್ ದಟ್ ಅಂತ ಹೇಳಿ ವಿ ಆರ್ ಸ್ಟಾರ್ಟಿಂಗ್ ಫ್ರಮ್ ದಿ ಗ್ರೌಂಡ್ ಅಪ್. ಸೊ ನಮ್ಮ ಶ್ರೀಕಾಂತ್ ಅನ್ನಗೆ ನಮ್ಮಿಂದ ನಮಸ್ಕಾರ ಮತ್ತೆ ಅಭಿವಂದನೆ ತಿಳಿಸುತ್ತಾ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ಶುರು ಮಾಡುವ. ಶ್ರೀಕಾಂತ್ ಅನ್ನ ಓವರ್ ಟು ಯು. ಥ್ಯಾಂಕ್ ಯು.
ಆಗುವುದು ಆದ್ರೆ ಇಂಗ್ಲಿಷ್ ಸ್ವಲ್ಪ ಸುಲಭ ಆಗ್ತದೆ. ಸೊ ಇಂಗ್ಲಿಷ್ ಡಂಪುಗ ಇನ್ನಿತ ಸೆಷನ್
ಅದೇ ಟರ್ಮ್ಸ್ ಅಂಡ್ ಕಂಡೀಷನ್ಸ್ ಎಲ್ಲ ಇಂಗ್ಲಿಷ್ ನಲ್ಲಿ ಸುಲಭ ಅಂತ ಆಗ್ತದೆ.
ಅನ್ನೋದು. All right. So just like Sudhakaranna mentioned, we had an overview of the healthcare industry 101 in the previous session. And I believe, that recording will be available if you want to follow up in our archives, online archives and YouTube. So please refer that. That is, a generic overview of the healthcare industry in US. And today's session is Medicare 101, which is designed to give an introduction to the Medicare, market segment, so to say, in the healthcare industry. So it's a federal government, and we'll see the key features and details. And many of us will be getting ready to roll into Medicare coverage with the government having the criteria as 65 years or older eligible for that. And we'll see some of the nuances of what this entitlement. Medicare is an entitlement. So at the very basic level of understanding we need to have is Medicare is a US federal health insurance program for people age 65 or older. So that's the basic criteria namge bekaddu. And people younger than 65 are also eligible sometimes to be enrolled in this program. But they need to qualify for those benefits with certain disabilities, like permanent kidney failure and the ESRD anta karitar adanna, end stage renal disease, or ALS, right, or other criteria. Similarly, at a state level, we have something known as Medicaid. This Medicaid program is a joint federal and state program, meaning the federal government puts in dollars into this Medicaid program. The state takes that dollars, adds some of its own dollars, and manages that program locally within its own state. So every state will have its own Medicaid programs. Sorry. Medicare is national, run by CMS, and Medicaid is at the state level in partnership with the federal government. Adella guidelines and requirements irtade, adanna they have to follow. So each state in the country has its own Medicaid program, whereas Medicare is a nationally available program. I'll give a minute for the people just to read, and I ball the material here. ಸ್ವಲ್ಪ verbose untu. So all right, moving on to the next slide. So for managing these two programs, right, Medicare and Medicaid. So the Centers for Medicare and Medicaid Services, commonly known as CMS in the industry, is a federal agency within the Department of Health and Human Services. So HHS is the organization within federal departments that owns or sits above the CMS entity, and CMS administers the Medicare program and partners with the state governments to administer Medicaid and other insurance programs like CHIP, and sets the standards for the industry to follow as well. And in turn, each state operates a department of insurance that will help manage and coordinate the Medicare, Medicaid, and other state-run programs. And just as an example, I've provided a link in this for the NCDOI, the North Carolina Department of Insurance, and what all it does. So we won't get into those details. I will let the audience take a copy of this presentation when they get it, and you can look into some of those items when you have a chance. And the final point here is there will be some beneficiaries. The beneficiary ಏನಂದ್ರೆ people who are eligible for Medicare or Medicaid or both. There's a special category of citizens who are known as Medicare dual eligibles. So these individuals belong to a population that meet the guidelines to be eligible for both these programs simultaneously. Andra, Medicare will be covered from a federal government perspective, and the state Medicare also will cover them because they are typically low income, or their total assets under their ownership is below a certain level. So essentially this duals program is for low income population that is quite susceptible to any type of health related issues that may need coverage. So this Medicare dual eligible population gets coverage from Medicare as well as the state Medicaids. Moving on. So what are some of the criteria and eligibility rules for Medicare, and we'll see what are the few things that are important for this program. For Medicare qualifying beneficiaries, Medicare coverage is considered an entitlement program and is guaranteed by the federal government. Meaning, if you meet all the criteria that is allowed for the citizens of the United States, or if you are a permanent immigrant like a green card holder, or if you are in a different visa status, as long as you meet the criteria for eligibility, Medicare will be made available to you when you qualify, either through age or through any disabilities or health conditions like we saw previously. And even if you have coverage through your employer or let's say your spouse, many a times both the partners in the house will be employed somewhere and they'll have coverage through their employers. It is always a good idea to sign up for Medicare benefits when you initially become eligible. And this is known as the initial enrollment period, IEPs. And this is offered 3 months before you turn 65. That is the enrollment window for this program opens up 3 months before you turn 65, the month you turn 65, and I think 2 or 3 months after. So you'll have a total stretch of 7 months to sign up for IEP. Okay, that's very important. We'll see later why that matters. Next, Medicare does not allow any dependents, meaning it's an individual level coverage for qualified individuals. So currently, if we are employed and we have insurance coverage through our employer, we are able to support our children up to a certain age. It's known as a maximum enrollment age. Those commercial plans will allow us to add our spouses, our children, and dependents, legal dependents, as dependents to that same coverage. But in Medicare, that is not allowed. Each individual has to individually qualify for that program. And in the second point, we said, it's a good idea to go ahead and sign up. The reason being, if a beneficiary does not sign up on time for these entitlements, right, for Medicare coverage, Part A, Part B, and others, they may have to pay a lifelong late enrollment penalty. And each year, this dollar amount is calculated, and each month of coverage you have under Medicare, you will be charged this late enrollment penalty, which is not easily taken off. Typically, to get it off, you might have to enlist additional help from your brokers, or many a times even with lawyers. So you have to go to the court to prove that a certain few things prevented you from doing it. And if CMS accepts it, they'll take out the late enrollment penalty. But it's a very involved and lengthy process. So if any of us in the audience today, or your family members, if they are eligible for that, it's a good idea to go take a look and make sure that you enroll in a timely manner. So now that we saw that what the eligibility criteria is, and how to quickly assess whether you are eligible for it. What does Medicare cover, right? So there are two parts to this program and how it is administered. The first part is known as Original Medicare, and it has three parts essentially. Part A is hospital insurance, and this covers, hospital insurance care, skilled nursing facility, home health, hospice care type of, settings. Part B is medical insurance that covers your providers and, services, DME services, ambulance, X-ray, so on and so forth. And finally, there's Part D, which is Medicare's prescription drug benefit, and provides outpatient, pharmacy drug type of coverage. So these are the three parts of Original Medicare. And there's a program called Part C, also known as Medicare Advantage. Medicare Advantage is offered through private insurers like Blue Cross Blue Shield, Aetna, Cigna, all these big carriers, and they can be local carriers too, like Harvard Pilgrim in the Northeast, or Kaiser Permanente in California region, so on and so forth. And Part C is nothing but a combination of Part A, Part B, and Part D in various flavors. So under Original Medicare, the federal government and CMS directly deal with all the medical claims and the claims that are generated through various services, and processes them. And Part C is like private insurance, but through a commercial payer who is managing Original Medicare on behalf of CMS. I hope this distinction is clear. So Original Medicare has Part A, B, and D, and Part C is a combination of that, administered through the private insurers. And I've also included a link that you can, look at when you have some time later. So the next obvious question is, it's great that, you're getting coverage for all these various parts. Are there any premiums to be paid? So the short answer is yes. For under original Medicare, Part A is free if you worked and paid Medicare taxes for at least 10 years. You may also be eligible because of your current or former spouse's work that has been contributed towards the system. So I think, this is one of the basic criteria. There's also, if you do not have, the 10 years worth of work or, so many tax credits you have to accrue, if that is not there, Part A can also be part of your coverage if you pay a small monthly premium. And each year, it is calculated and, you have to buy into Part A if you don't have, the 10 years worth of Medicare taxes paid. For Part B, most people do have to pay a monthly premium, and the exact premium depends on your income level. So post 65, if you continue to file taxes and if you show that you have, some income through your assets or, other things, the CMS has published guidelines that will set the premium based on your income level for that particular time period. Similarly, Part D also comes with premiums, and it varies by the plan that you pick for Part D coverage. And again, you might have to pay more if you are making, above a certain federal income level based on your retirement income. And there's a very important offering called Medigap or supplemental plans. These are known as Medicare supplemental plans or Medigap. These plans also have a policy premium, and they cover, your out-of-pocket costs and other, expenses that might not be covered under original Part A, B, and D. So Medigap policy is like a additional coverage you have to purchase in order to protect your out-of-pocket maximums. So coming to Medicare Advantage, which is also known as Part C, the major medical plans will typically include your RX coverage, similar to what you might have enjoyed under your employer. So employers also offer their employees, one plan that has medical benefits, like hospital and doctor's visits covered, along with a drug. So these are typically termed as major medical plans, and Medicare Advantage plans will offer the same combination that will cover Part A, B, and D for you in one bundled plan. And some of these plans may have a premium, or they typically come with $0 premiums to make it attractive for the member to enroll into that particular program. And Medicare Advantage typically also includes a few ancillary benefits like, dental, vision, hearing aids, gym membership, etc. These are to enrich or augment the benefits as compared to original Medicare at no additional cost to the beneficiary. So all this is offered to make it enticing for the population to pick Medicare Advantage and roll with that program for their coverage. So that is for the premiums. So what is important in this process is, it's very, very critical to know that because it is an entitlement from the federal government, you have rights, and these rights are forcefully protected and enforced by CMS. So if you are a Medicare beneficiary, the CMS will be your best buddy in this process, right? And they will stand by the beneficiary in terms of any questions or grievances that are reported to the CMS. The CMS takes member complaints very seriously, and it's a major part of the programs where it is. Oversight is always provided, even retrospectively. Even after a year or two after the incident has occurred, the CMS team can always show up at any provider or a payer's insurance company's office and audit that particular case and demand evidence, and it is known as a CMS audit. And as we already saw, enrollment into this entitlement, the timing is a critical point to get right, so that you can enjoy your entitled benefits without having to pay penalties. So, and the funny thing is, every year these penalties keep going up, right? So that's the common experience we have across the health insurance industry in the US, where the cost to participate and to get care only keeps creeping up. And that's for various factors. We won't go into those discussions now. But essentially, if you want to have this Medicare coverage at no additional cost to you, enrolling into those benefits in a timely fashion is important. And if you're a busy individual and you don't have time or you don't have the bandwidth, to do all the research and educate yourself, the best course of action would be to work with a licensed Medicare broker in your local area. There'll be many agencies and agents who will be glad to assist you in enrolling either in original Medicare plan or a Medicare Advantage plan. And they will take a fine-grained look at your situation and they'll come up with some recommendations that can work for you, depending on the degree of care you need, how sensitive you are to out-of-pocket costs, and other criteria that are important for you. Moving on. So a common and most logical question is, what is the best coverage for me? Should I take original Medicare? Should I roll with a Medicare Advantage? Should I stay with my employer's plan through my employment, right? So these are, should I stay as a dependent on my spouse's employment plan? So these are the typical questions. There's no one solution that fits each individual's criteria absolutely. So research will be required to to determine what is best for that individual's coverage needs. And again, a licensed Medicare broker will be is best positioned to help you with your queries. And they typically have access to tools that can kind of forecast based on your health conditions, your current consumption of medical care. They'll come up with cost comparison and benefit comparison between original Medicare or a Medicare Advantage plan with or without Medicare coverage, and provide you an opportunity to pick the one that fits your needs. I've also included a bunch of reading criteria that can help you understand what these programs are. So I have given a lot of information links, right? If you want, we can go take a look at one or two sites here, just to make sure that we understand, or if anything is of particular importance. Or we can go back and take a second look at any slide that you have questions for. Well, Sudhakarana, this was the last slide for the day.
Yeah, questions ಹಾಕಿದ್ದಾರೆ.
ಹೌದಾ? Okay.
So if you have access to the chat, there are a few questions posted there. I'll start
Okay.
I'll start with the notation, then go up. Or the prashna, is there a max out of pocket for A, B, C, or D in that? And he has some follow-up questions as well.
Yeah, okay. So is there a max out of pocket for A, B, C, and D? Under original Medicare, I believe, once you meet your deductibles, there's a 20% co-insurance that you have to pay for all the charges that you might incur. So in theory, there is no upper limit, so to say, and that's where the Medigap or supplemental plans come into play. So there are many plan designs that CMS approves. There are like, I think, A, B, C, D, up to K, G, or L, right? And the most popular one is Plan F, I believe, but the brokers will be able to better help you there. So if you enroll into original Medicare with parts A, B, and D, you should plan to take a supplemental plan coverage as well that can limit your out of pocket, that can cover some of your out of pocket costs. And the next question is, how much do they typically cost? These Medigap policies will vary, depending on the plan design. So the average, I think, is around between $100 and $150. The next question there was, can you buy a plan for it upfront when you are younger? No, there is no such provision I am aware of where you can buy a plan when you're younger. So when you're initially eligible for Medicare coverage, you go ahead and enroll into Part A, B, and D. And when the very first time, this is important, Medicare plans are offered by health insurers again, okay, private insurance companies like Aetna's, United, Cigna's, so on and so forth. You can also pick and choose a Medigap policy of your choice. And only in the first year you're eligible, and the first time during your IEP, they have to accept your Medigap application. They cannot deny you coverage. Okay. For example, let's say there are two individuals, individual A and individual B. Let's say during their initial enrollment period, individual A picked original Medicare and Medigap, and individual B went with Medicare Advantage or Part C. Okay. And for being eligible to buy Medigap policy, you have to be on original Medicare. That's a requirement. So individual A can get A, B, and D plus Medigap. And the very important thing here is there are no medical questionnaires and they cannot deny coverage into Medigap policy. And individual B, right? So is enrolled into Medicare Advantage Part C. So Medigap does not apply. 2 years down the road, if individual B wants to switch from Medicare Advantage to original Medicare and buy a Medigap policy, there's a chance that the Medigap policy can be denied based on health questionnaires. The next question is, why should one consider Part C Medicare Advantage? What are the advantages of having private insurance manage or administer? This is a very common and good question, and the basic understanding is required. The advantages of Medicare Advantages, it flows through an insurer who might be local to your area, right? So you'll always have a local insurance company to deal with rather than the CMS. Number two, they also offer ancillary advantages that are not typically found in your original Medicare. And most importantly, they might come with $0 premiums and will also automatically limit your maximum out-of-pocket costs. So these are the typical benefits, of Medicare Advantage. But the one restriction and limitation that patients generally don't like is, if they like to see a certain specialist for their care or their medical condition, they have to get a pre-authorization from the insurer. So it is not a restriction, but it imposes some barriers to care before they are allowed to avail it. Whereas in original Medicare, you can walk into any doctor's office who accepts Medicare and get the care you need. Another question, I'm going up, I'll come back to the other ones down here. What are options for someone falling off of parents' health insurance, for example, student over 25 years, Sudhakaran asked. That's a great question. So the only option is if your employer's policy will dictate how long you can keep your children as dependents on the policy. Typically, the industry average or the industry cutoff is 26 years. So anybody who is 25 years and 364 days will be allowed to stay on. And once they turn 26, they have to sign up for their own individual policy, outside of the parents' policy. The first question in the series was, what is Medicare taxes? Is it the same as Social Security contributions? Prakashana, that is one category. So Medicare taxes go directly for the Medicare program, whereas the SSA is a different type of contribution. And SSA, I think, you also avail, Social Security Administration will send you a check when you retire. And one of the options is to pay the Medicare taxes directly out of that SSA. So there is a contribution called payment withhold in the program. And SSA is one area where you can deduct that Medicare premium payment from your Social Security check. So both are federal programs, but different purposes.
So in continuation, Anna, so when does one start the earliest to contribute Medicare taxes, and how?
I believe, it comes out of the paychecks that are run, or when you file taxes, they assess it. There are many routes, but the most common one, and the one that I'm familiar with, is through an employer's paycheck. So if you look at your paycheck closely, there'll be a variety of, deductions at source, right? Majority of them will be federal, state, and your benefits through the employer. So Medicare taxes, I believe, will come out of the payroll contributions.
Oh, it's already there? Okay, I might not
Yes.
have observed it. Okay.
Yeah.
Sreekanth, there is a question that was sent directly to me. This is from Anjali Avaru. And let me read it out. My parents have Medical, and their Medical pays for their Medicare Part D. When they leave for India, Medical is put on hold since they stay there for a longer time. However, they cannot put the Medicare on hold and we start getting billed for it. So our question ಏನಂತ ಹೇಳಿದ್ರೆ, if they are not in the country, can Medicare be put on hold and reinstated when they are back? And if that's not the case, can they put in a fresh application during the enrollment period?
Okay. So this situation is kind of complicated. So I'm not too familiar with the basic medical or the intricacies of it, but definitely Medicare, there is no pause and halt or re-enrollment type of arrangements. They will allow beneficiaries to enroll throughout the year. So there is no particular time frame, but there are dedicated windows of enrollment. Like we have annual enrollment period, will start on 10/15, which is October 15, next week. The official Medicare annual enrollment period begins. And I think Prakashan also asked one question: can one enroll for original Medicare but then switch to Advantage and vice versa as they wish any number of times? Short answer is yes, but you have to qualify for that. So every year, the beneficiary will have an option to switch during annual enrollment period. They can go in and out of these programs, but they cannot put a halt to the Medicare, coverage. It's a continuous coverage. It has some assumptions built in. And Medicare will typically cover only original Medicare, I should say, covers only US based, coverage. So if you have Medicare Advantage, let's say Blue Cross Blue Shield is quite famous for this. They offer something known as, worldwide coverage, where they will cover emergency type of care if the beneficiary is traveling, let's say, to India, right? So, and they are enrolled through Blue Cross Blue Shield. Blue Cross Blue Shield can potentially have that benefit at no additional cost, saying anywhere in the world, if you need emergency room care, we will cover that cost for you. Medicare will also do that, but once you come back, you have to file for a claim, right, for reimbursement. And Medicare, original Medicare will have the co-insurance and the deductibles, criteria to be met. There is no concept of a fresh application during enrollment period. So if you didn't apply when you were initially eligible during the IEP, you can always join Medicare, but then you will start paying penalties for it. So you will continue paying penalties till, you're exiting the program for whatever reason, which typically is the establishment of what we term as the date of death. So that's the official, termination from coverage for the typical beneficiary. So you can't put Medicare on hold or pause that, or not pay the premiums. Medicare, of course, there's always something known as special enrollment periods, SEPs, where there are certain conditions that allow for enrollment or not paying some premiums in terms of hardship if you face it. So the question I see is, what is the amount of penalty? So part A, B, and D, all have different penalties. The most common one is known as LEP, late enrollment penalty, which is typical of part D. And that amount varies every year. So it's available on the CMS website. So the LEP amount is determined by the CMS each year. And the beneficiary will be, liable for paying those penalty bills.
There is one question from Vijayanna.
Right.
What would be the best option for federal employees entirely?
So what would be the best option for federal employees staying with the employer, provided insurance after retirement, or enrolling in Medicare? Because the employer provides the same coverage for same premium even after retirement. So Vijayana, it is difficult to say without looking at the benefits or the costs, right? So I would recommend you work with a broker, but the general guideline is, when you are eligible, or anyone in your household is eligible, to just go ahead and sign up for Medicare. You don't have to take Medicare if you like your employer's insurance. You can continue with your employer's insurance as long as you are allowed to stay on it. And when that employer's insurance ceases, you will be automatically enrolled into Medicare. But the big difference is you don't have to pay a penalty. They will not make you pay penalties if you signed up during the IEP and said you have employer insurance and you don't need Medicare. So Medicare will consider that. So they will bring you into Medicare coverage at no additional costs.
Okay, got it.
So Anjali has put up another question. So which means that if I do not pay the premiums, I will lose Medicare and cannot re-enroll until I pay the premiums and penalty retrospectively. I don't believe Medicare coverage will cease. I haven't seen those, but the penalties will continue. They will continue to attract interest also after a certain period, I believe, if they're unpaid bills and, it doesn't go away until you pay for it. And the Part C insurer, let's say United in this case, for example, if United is billing you for those late enrollment penalties, they will continue chasing those dollars. I'll have to check whether you can lose Medicare coverage for not paying premiums. It may be a situation, but I haven't encountered it too much in my years of service for payers. They don't disenroll for small amounts because the CMS pays 12 to 1500 on an per beneficiary average, so that's significant amount for the payers.
I think those were the questions that we had. Certainly, it's a very complex topic indeed.
And there's a low-income status that the Medicaid program will also determine. If for the duals typically don't have any bills to pay. They just covered under Medicare and Medicaid automatically because of their financial situation. And that is to make sure that, as a society, we don't allow them to fall through the cracks when they can't afford to pay for it. So it's a great initiative. But those criteria are quite different for those members as compared to the standard Medicare members. I want to go back to Prakashanna's question. Can one enroll on time for original Medicare but later switch to Advantage and vice versa? The short answer is yes, Prakashanna. Like I said, AEP, right? Annual enrollment period is an opportunity to switch every year. And there'll be there's something known as an SEP, right? A special enrollment period. Like natural disasters, right? We had Helene cut through, so many states. So people who are affected by that can use that as an opportunity to, switch payers to get the medical care necessary. So CMS will allow those type of exceptional conditions to be. Anantanna asks what all things need to be considered when choosing a payer. Good question. So very first thing is you have to consider, the payer's, reputation in the market. So, and another thing is, do you travel a lot or are you local for a large part, right? That's also a big consideration. So if you are staying in your local area for a large part of the year, you don't travel very much and all, an HMO plan design might, be important. And you can pick an HMO plan from a reputed company like a Blue Cross or a United, Cigna. All the big payers will typically offer you good benefits. And there might be local powerhouses also, right? Like in the Northeast area, we have Harvard Pilgrim Healthcare, which is quite a heavy hitter, meaning they are very popular because of their rich benefits. They have a very strong brand presence in the Northeast region or wherever they serve. That might be a good local pair to go with also. And if you travel a lot, if you have like a summer and a winter type of living arrangement, and you travel within the US quite a bit in the as a retiree, then it might be better to go with a PPO plan. And again, a larger insurer will have a better provider network. That's one thing to consider. The next important thing many people consider is the premiums for these plans. If you get a $0 premium, nothing like it. But some richer plans might have, some richer PPO plans might have a monthly premium associated with them. And also, you need to pay attention to what is the cost share. The member cost share, so to say, which directly impacts your out-of-pocket maximums. And again, your best bet is you can work closely with your local broker who will have, insider knowledge on the various pairs and, what are the differences. Thank you. There's a question, does pre-existing conditions affect Medicare premium? My understanding is no. It does not require you to fill out any medical conditions or anything. So there is no denial of care for those. So part A, B, and D have guaranteed, coverage from the federal government. CMS sets those rules, and even if you go with Medicare Advantage, all the payers are required to cover what original Medicare covers by default. They cannot deny a claim for a condition that is included in Medicare Part A, B, and D.
I think that's pretty much all we have. We have about 5 minutes left. If anyone has questions, you can come off mute and ask your questions. I think Sreekanth, you gave me an idea about the broker. That's a service that we could probably offer through our Kutumba.
Yeah, there is a requirement though. Not everybody can sell Medicare. You have to go through some licensing, with the state and, meet some certain qualifications.
Yeah.
You have to, I think, take
The
a
brokers
professional exam.
we can enlist brokers, Allah.
Yeah, definitely. We can always enlist. But if any of our members are, already in that business, that would be nice to get their professional opinion.
Yeah.
That will help with, enrollment into this program.
Yeah, that's something to consider to see if our Kutumba might be interested in offering as a added benefit to our community. I'll take it offline.
Yes, because there will be a lot of HIPAA considerations, Health Insurance Portability and Accountability Act, that kind of protects the patient's information and enrollees' information. So it's called PHI and PII, Protected Health Information and Personally Identifiable Information. So these two data sets are governed by federal and state regulations. So a licensed broker will be our best bet to discuss one-on-one what is the type of coverage that might be best for us.
I think we have Prakashana, you can come off mute and ask.
Okay, can you hear me?
Yes.
Okay. My super question was, regardless of whatever one's insurance coverage is or whatever it is, assume that there's no insurance coverage. Does any medical facility have the rights to deny treatment because one is not covered? In that case, how the coverage works?
Yes, good question. The answer is, there's no blanket rule like that. The short answer is care cannot be denied. I know of a situation where hospitals cannot deny care for individuals who come into their facility through the ER. So if they come in an ambulance or are an ER case, emergency room, the hospitals are not allowed to deny care for a lack of information on, insurance. So our typical experience is if we go to a hospital, the first thing they will do is they'll triage the patient. Unless, it's not an ER situation, but the common situation is they triage you, ask your insurance information, and then admit you. Whereas if somebody comes through an ambulance, they are taken directly to the ER. The patient has to be stabilized and brought out of danger, and they cannot, start chasing them for insurance information. And in such cases, the hospital will probably have, they'll submit claims to the state. And the state Medicaid program will decide if they want to pay, and if they want to pay, how much they'll pay. And sometimes this is also outsourced to private insurers. There is, in the industry, there is something known as the payer of last resort. So if nobody pays in that particular state, let's say that the state of California, let's say it gives that payer of last resort designation to Blue Cross Blue Shield of California. Okay, any state Medicaid claims that are denied or partially paid or unpaid by the state will roll into Blue Cross Blue Shield of California for final adjudication and finalization. So there they'll have their own set of rules to determine whether that claim should be paid to that hospital or to the provider, and then they make that determination. So there are channels for reimbursement opportunities, but it's not straightforward or guaranteed.
So is this agreement limited to only emergencies, or post-emergency when they're stabilizing, there will be cost of the treatment? Will that
Right,
also be
yeah.
covered? Can they deny such treatment?
Yeah, there are many criteria, like I said. So there are episodes of care is a new thing that they do, or they do bundled payments, meaning once a patient is admitted into the hospital for a particular condition, let's say it generates 5 claims per day, and the patient was in the hospital for 10 total days, is stabilized, he or she, and they're out. So all those 50 claims, the 5 claims per day for 10 days, might be lumped as one claim. And they'll say it's an episodical, type of claim. For this entire episode, for this one patient for these 10 days, we will pay you a lump sum, and typically they have a chart known as UCC, usual and customary costs. So, and it's built on various criteria. The payers will typically pay based on those criteria, and combining these various claims. There are many ways to process medical claims. It's a complex adjudication system, and each payer and the state situation will vary. But yes, there is a potential to get paid, but not whatever is billed.
Okay, thank you.
So I think we have just a couple minutes left. If not, then we'll probably wrap the session up. I'll just give 30 seconds for anyone else to. Are there any questions? Again, thank you, Sreekanth Anna. Bala ಚೆನ್ನಾಗಿತ್ತು. Thank you for walking us and educating us on an intricate and complex topic as a health insurance, in addition to Medicare. Many of us will be in that situation, not in the far distant future, and I think this information is kind of a stepping stone to help us get there. I'll send this recording along in the next couple of days with the presentation. I'll put it on our WhatsApp Kutumba group. Until then, Sreekanth, thank you again for your time. And for all the participants, thank you for your time, for coming on this busy Navaratri period. And stay healthy.
Thank you. And the presentation has some very useful links. Please go through it. If a follow-up session is required, I'm more than happy to come back.
Thank you. Sudhakar, can you make sure that those links are posted below the YouTube?
Yeah, ನಾನು ಮಾಡ್ತೇನೆ. I'll send it out as a PDF document with clickable links. ಆಯ್ತು ಹಾಗಾದ್ರೆ ಧನ್ಯವಾದ ಎಲ್ರಿಗೂ. ಶುಭರಾತ್ರಿ, ಶುಭಮಸ್ತು. Take care and enjoy your Navaratri.
Thank you.
Thank you, everybody. Namaskar.
Thank you, Sreekanth Anna. Thank you, Sudhakar Anna. Good night.
Pleasure.
Night.
Thank you. Good night, everyone.